So this time of year, most businesses other than retail stores slow down to a crawl. In fact, many close for the holidays.
But this is one of the busiest times of the year for plastic surgeons because people can take time off and recover without other people wondering where they are.
Dr. Max Gomez is here with word of a new computer technology that allows patients to see exactly what they're going to look like. Should Santa be bringing, I guess, a new nose this year?
Among other things. Good morning, Mary. Good morning, Otis. You know, one of the hardest things about cosmetic surgery for patients has always been visualizing what they'll look like with a new nose, tummy tuck, liposucked hips, and so on. Now, they'd bring in pictures of friends or clips from magazines. Not a great way to see what you'll look like. Here's a better way, and wait till you see what I look like with a new nose. In our beauty-obsessed culture, there are many who aspire to have the hips, thighs, bust, nose, and eyes of the Victoria's Secret models. That will lead almost 2 million Americans to have cosmetic surgery this year. Trouble is, patients often have unrealistic expectations.
They come in with pictures of their friends or pictures of models or magazines, and they say, I want this.
Not to mention that a model's nose, lips, and hips may not fit your body. But these women were confident their plastic surgery would be right for them.
That's you. It's not a frontal picture of someone and they're saying this could be you. It's you.
It's not just a doctor telling you or a sketch. It's really your body. It's not a mannequin.
What they're referring to are the images that come from this computer system called Vectra. It takes multiple 3D photos of the particular body area you're thinking about having work on. Then the magic starts. Using specialized software, Dr. Breslow can then modify the patient's own image to show them what their surgery will look like on their own body from all different angles, like Michelle Brinksma's nose.
It lets you see the results before the procedure's even done. So it's just amazing to see what you look like after.
For breast augmentation, the system can show what every size and shape implant on the market will look like, although a patient would see herself without a bra. But as amazing and useful as the technology is, it has to be used properly.
I can do anything on the computer, but I can't do anything in surgery. And if I make an image that is not realistic, then I'm not doing my job very well.
But for Gail and Donna, Vectra was a tremendous help.
You're seeing your size, your actual body.
It takes the guesswork out of it. It really does.
Now, the Vectra system is also useful to show patients what they would look like with non-surgical procedures like injectable fillers and laser skin rejuvenation. Now, just to show you that I have a sense of humor, I stuck my face in the Vectra and had Dr. Breslow fiddle with my twice broken and 3 times surgically repaired nose. As you can see, you can alter the bridge, the tip, the width, the nostrils, and what most people want, also the length of the nose. Ooh, man. Now, obviously, some of this is just goofy, and you'd never do it, but you see what your new nose will look like on your face. And I got to tell you, seeing your face in high-def 3D is not an experience for the faint of heart. Oh, there he took out, I think he made my chin longer, too, at some point.
Now, the top of your head is
yes,
going
we're going to have to do something with that.
Oh, well, yeah. The hair transplant will fix that.
It's interesting stuff, though.
Well, yeah, but you can actually see it on you, and that really makes a difference. I mean, when the people were coming in and they were getting it, and they're seeing it, they're going, first they said, oh, my God, that can't really be me. But then they said, that's amazing. Yeah. This is how I would look, and you know, then you really get a much better feel for what it's actually going to turn out like.
And who knew this was the time of year everyone's doing it?
Right.
Well,
makes sense, though.
If you can take a week or 2 off and recover, and nobody's looking for you.
My kids would love that software just to mess around with my nose. They're always getting on me about that anyway. So.
What's the Vector, Victor?
Over.
Let's take some pictures. Why mess with perfection, though? Dr. Max, a very handsome man. Why would you want to do anything?
That cost me $20.
Money well spent.
Yeah, I could buy some gloves for Otis.